My name is Giulia Besana, and I'm a research analyst at the European IDC Health Insights team, focusing on the role of digital transformation in the value-based healthcare scenario. The next 15 to 20 minutes, I'm going to give you an overview of the renewed role of patient engagement in what is the next normal for healthcare. We are going to see why patient engagement in the health intelligent enterprise is so relevant for healthcare systems across Europe. With the pandemic, there has been a great emphasis on the capability of healthcare systems of increasing their capacity and outreach, and preventing what is preventable and prepare for what is imminent. But as we unfortunately enter the second wave in Europe, we understand that some challenges are here for the long ride. So healthcare systems are quickly realizing that they need to build a new relationship with patients, make them becoming their closest allies. At IDC, we have been closely following the impact of COVID-19 since March, asking every 15 days to healthcare organizations across Europe about how the pandemic is steering their digital investments and strategies. COVID-19 is emerging as an accelerator of the transformation of patient experiences, with healthcare providers that are looking into enriching and complementing patient engagement models through digital solutions. They're also looking at prioritizing experience excellence in healthcare service delivery, but they're also seeing patient engagement as a strategy to support resiliency by adapting and responding to the current crisis. And as an analyst, I personally think that this last survey result is what should make us realize that there is a profound change in this approach toward patient engagement and patient experience. And we're seeing this in several initiatives and in the launch of digital services that have been deployed or scaled up during the first wave of COVID-19 in Europe. The examples that you can see here span from AI-powered chatbots to inform the population while freeing up doctors and nurses' time to care for critical patients, to remote monitoring and video consultation for patients in home isolation or in need of medical care. But also, healthcare organizations are looking at new ways to help patients adapt to this new normal of remote care delivery, and are supporting their patients and healthcare workers in the process. As an example here, the Marina Salud Hospital has launched a remote consultation service for patients who can be managed remotely by their doctors without the need to go to the hospital. But doctors invite their patients to the platform, and the first virtual encounter is also supported by an IT technical person to make sure that the experience is seamless and as positive as possible for the patient. But besides the handling of this particular emergency, of this healthcare crisis, is patient experience relevant also for the long-term strategy of the healthcare organization? Multiple studies have consistently demonstrated strong association between patient experience, clinical outcomes, and patient safety. But also, a growing body of evidence is showing a strong correlation between patient experience and the financial performance of hospitals. Patient experience is therefore increasingly viewed as a valid indicator, as well as a major determinant of the overall performance of health providers, directly or indirectly influencing their profitability and competitiveness. Recognizes this trend, patient experience is rising on the agendas of hospital executives globally, with growing investments, as you can see here, in patient experience transformation and the consequent reorganization of how care is delivered and care delivery models. So how can healthcare organizations excel and master patient experience? The answer lies really in the definition of value for health. Value is defined as outcomes that matter to the patients and the cost of achieving those outcomes. Value is measured taking into consideration patient clinical outcomes as well as patient experience, and they're both compared against the related cost along the whole care cycle, so not just the single encounter. To excel in patient experience, healthcare organizations must start building a new vision of themselves through the lenses of patients, focusing on measuring and maximizing the value delivered to each individual patient at every single touch point of the care continuum. What is value for children and their families in the healthcare journey? Besides, of course, care and good health outcomes, value is a positive experience designed on the needs of patients, who in this case are children. The Copenhagen Children's Hospital vision, despite not being the most recent one, is still very relevant when considering patient value. The Ring Hospitalet wants to be an innovative, digital efficient hospital where digital solutions support patients and families in a vulnerable situation, both during and between hospital visits. Play is the core of the whole experience design. Processes, doctor-patient encounter, as well as architectural elements are designed to ensure that children will be children, even in a healthcare setting, by providing a child-friendly and not childish environment. And the second point, a digital-first model of care and patient engagement that encourages and supports the use of mobile and digital tools to enable patients and their family a greater experience and giving them back control in the small things, from booking appointments to selecting a favorite theme or movie for the child and having the system remember it for future medical visits. A system that helps employees to cooperate effectively and flexibly and ensure that the right information is readily and securely available for all relevant parties at all times. This is key on the patient's end side because it allows a smooth experience that does not stop when, for example, the usual doctor is not available, but proceeds smoothly as the new one, as all the information is in a snapshot. And obviously, everything needs to be backed up by technology. That is the basic pillar of all operations and support all functions and departments across the hospital. However, good IT is in the background and works so smoothly you do not realize it exists. This vision requires really building a new platform for business resilience, growth, and innovation. A platform enabling a patient-first vision, not only to amplify reach and access, but to deliver empathy at scale, getting closer to the patients, enhancing the engagement along the entire health journey. With COVID-19, we see an increased adoption and use of digital tools that enable new care delivery models at the intersection of healthcare workforce empowerment and population and patient engagement. Enhanced collaboration tools are essential in the coordination of work because they help teams to organize shifts, unit member responsibilities, as well as coordinating the efforts and managing resources at territorial level across different healthcare providers and players. But they're also allowed to train the workforce and prepare for what is coming. As an example here, the Bordeaux University Hospital has launched the first digital training simulator to support caregivers in their care of symptomatic patients. This has an enormous impact on both care teams, who of course receive the guidance and best practices in an unprecedented health crisis, and for patients who benefit from the skills of trained care professionals. There is also, on the other side, a strong push from the authorities to protect healthcare professionals from direct face-to-face contact with patients to avoid the risk of infection, as well as the need to protect most vulnerable patients who need ongoing care and who need to visit infected areas. The St. Helens and Knowsley Teaching Hospital NHS Trust has rolled out a telehealth and video consultation service. And since the introduction of the technology in the stroke review service, the Trust reports did not attend rates dropped from 25% to just 10% in 6 months. So we see that benefits are not going just in one direction. Better engagement with patients can also help organizations in improving their operational resilience. Virtual care can further enhance the capability to collaborate in multidisciplinary teams and improve work experience in groups. And this workforce experience point is particularly important as it shows that to develop empathy at scale, you need to work on the agility of the organization and processes, so not just on the front end. Efficiently orchestrating information really matters in these patient engagement systems, as information and insights need to be safe and actionable, relevant to the context and time during which the patient is interacting with the healthcare system. So, as we say, the right message at the right time, of course, and to the right audience. But also considering that in modern healthcare, we have a two-way communication with the audience, and that healthcare organizations need to find the tools that allow them to incorporate the feedback and contribution of patients to their care journey. Therefore, it's not just a matter of developing an omni-channel strategy to engage with patients. It's rather more about identifying what are the golden channels that work best for that specific patient in that particular context at that time. It's about adapting to patient skills and preferences, offering them choice and giving them back control. A patient engagement strategy should orchestrate a number of different solutions that will have, of course, different roles, depending on the type of patient and level of interaction and insights needed. Here in the slide, you can see that healthcare providers are investing or planning to invest in a wide range of solutions that go from more traditional ones as patient portals to the use of innovation accelerators such as artificial intelligence, IoT, and robotics. But what is important to note here is to overcome the approach of seeing each of them as just a separate technology stack. They need to be seen as part of a more comprehensive platform that helps orchestrating and leveraging information produced by healthcare organizations and by patients to deliver messages, automate processes, and enrich the experiences of patients in a coherent way, whether it is online or in person, across the whole healthcare continuum. Integration between these tools is necessary, and integration of different tools has always been central in the Finnish digital healthcare strategy that you can see here, where, for instance, digital prescriptions and the National Electronic Health Record garner over 1 million discrete users per month. This approach enabled Finland to respond to the crisis early, launching a successful COVID-19 specific online symptom checker and education tool, which is called the Omaolo National Digital Services. Omaolo reaches approximately 2.5 million people in Finland and helps residents to assess their need for treatment or services. But how does it work? After filling in the questionnaire, respondents are provided with coherent and personal instructions on what to do depending on their symptoms. Besides the symptom checker, Omaolo also offers support in identifying the right services, offers personalized plans based on symptom severity and conditions, including periodic health and well-being virtual checkups to monitor the situation over the period of time. Data are also collected safeguarding patient privacy and are used in aggregated and anonymized form to provide real-world evidence to COVID-19 research, as well as to refine the service itself. So again, you see here how this approach to patient engagement is not only beneficial to patients, but also to the whole healthcare organization. Healthcare organizations that want to devise a successful digital strategy for patient engagement need to define what are the goals. It can be enhancing the efficacy of prevention, keeping patients healthier for longer. It can be also increasing access to services. There are plenty, and each organization will have its own priorities. To move ahead, healthcare organizations need to carefully plan to deploy the vision through horizons. For each horizon, they have a portion of the roadmap that is comprised of different business use cases. So let's start with Horizon 1. Horizon 1 consists of use cases that can be developed today, such as tools and services that are addressing all the current engagement gaps. So, for example, we will be looking at the most immediate needs of patients in specific pathways. It could be a COVID-19 information service, an online triage tool, a remote patient monitoring services, and you name them. In Horizon 2, the organization develops a more organic patient-first vision and includes in the roadmap the items that can be incubated now, but require a bit more time, such as the design of the coherent digital front door. Here, the more pervasive use of more complex solutions such as AI, edge computing, advanced network analysis come to play and complement traditional tools such as personal health records, CRM, and call center systems. These technologies allow to activate an intelligent enterprise ecosystem that will underpin patient-centric collaboration and operational agility within and outside the organization. And finally, Horizon 3. The Horizon 3 is more about imagining what possibilities that such patient-of-one intelligent enterprise vision can open. The objective here is to ensure that engagement services are able to continuously improve, thanks to the organization's ability to learn from patient data, feedback, and interactions, as well as from the response of the healthcare system. It's really about developing the ability to embed insights into the engagement workflow and fine-tune services and tools to actually bring empathy at scale through personalization and integration in a patient-of-one vision. So this value-driven, use case-centric mindset can help organizations keeping their actions in line with their objectives, allowing them to plan for scalability, but also at the same time ensure enough flexibility to adjust it to the emergence of new opportunities and priorities. This is the end of my presentation. I really hope this gave you a better outlook on patient engagement in the health intelligent enterprise. Thank you very much for your attention.